Welcome and thank you for standing by. At this time, all participants are in a listen-only mode. During the question and answer session, please press star 1 on your touch-tone phone. Today's conference is being recorded. If you have any objections, you may disconnect at this time. And now, I'd like to turn the meeting over to Mr. John Hargrove. Thank you.
Thank you. This is John Hargrove from the Children's Bureau, and I would like to thank everyone for joining us today for this call. Hopefully you're in the right call. It's Finding Meaning in Your Data, Strategies for Identifying a Waiver Initiative. And I'm joined by my colleagues, Kurt Heisler and Valeria Fajardo. And we're going to move through the PowerPoint presentation, which I hope is up on your PC screen at the moment. We plan to take quite a block of time at the end of the presentation for specific calls. However, there is an option to type in questions on the screen, and if we get too many of the, we will attempt to answer those questions that are typed in, but if there's too many, we will have a copy or get a transcript of those questions, and we can certainly make an effort to farm those out and see that they get answered. So with that in mind, I'm going to turn this over to Kurt, who will speak first, and then Valeria, then myself, and we'll go back to Kurt for a closing. And so I'd like to introduce Kurt to start.
Okay, thank you, John. I would just like to start by going over the outline for today. We'll be covering very briefly the general background of the child waiver demonstration, sort of some of the history, and then the highlights of the most recent IM that does introduce some new ideas and priorities. Then we're going to go over just some general strategies for selecting the overall focus. In other words, what do you want to focus on in your waiver, and how might you come up with a focus? And we sort of have two strategies that we're going to review. Then we're going to go over some strategies for drilling down. So once you have a general idea of maybe the population you want to focus on or the outcome you want to focus on, how can you better understand what's going on behind the scenes? In other words, is it limited to a certain age group or a certain setting? And we're going to be going through about 4 examples of ways that you might drill down your data to better understand that, because that will inform your intervention so you can make it more targeted. We're going to be very broad with these strategies, and we're not going to be discussing some of these next steps here about the intervention and evaluation. That's not the focus of this call. That's a whole other area. In other words, now that you know what you want to focus on, what kind of strategy will you put together? Will it be an evidence-based intervention? Will it be some sort of other intervention? How will you evaluate the program? Those are aspects we're not covering today, but they're aspects you definitely have a lot of TA available for, and we're going to go over some of those TA resources at the end. Also, the other thing, we're focusing on traditional outcomes, the traditional outcomes of permanency and safety, and we're not emphasizing a lot of the well-being outcomes. We do cover a couple examples, but as most of you know, there is a IM that came out about a month ago that discusses the Children's Bureau's new focus on well-being. So the idea is to enhance our traditional focus on safety and permanency, but also focus on well-being for children and families. So that's cognitive functioning, emotional and social behavioral functioning. We're not going into a lot of examples simply because the data we use, AFCARs and NCAMs primarily, doesn't have that kind of information in it. But we want to make sure to emphasize it's an important feature of the waiver. So just because we don't give an example of it doesn't mean you shouldn't consider it. So some brief background of the child welfare waiver was authorized by Congress in 1994, and then it was amended and expanded in 1997 by ASA, and then it expired in 2006. But the reason we're here today is because it was reauthorized for another 3 years, 2012 to 2014. It's called a waiver because it waives certain requirements of existing legislation and regulations at allowing states to use money that's been allocated to one area in a more flexible way and reinvest it or shift it to another focus. So that's the idea here with the waiver. But the overall purpose is to allow more flexible use of federal funds in order to attest new approaches to delivery and financing structures, all with the goal of improving outcomes for children and families. For those of you who hear a chime throughout, that's on our end. We're trying to figure out what that is, so hope it doesn't distract any of us too much. Between 94 and 06, we had 23 states participate in at least one or more waiver demonstrations. And this is a very useful link for some of you because you can read details about every waiver that has been done and how they evaluated it, what they found, the approach they took. It may be very useful in generating your own ideas. The current IM that we are focusing on is available at this link as well. It came out last week or this past Monday, but there's the link to it as well. So the goals of the waiver, they must address one or more of the following, and these are three broad goals. The first is to increase permanency by reducing the time in foster placements and promoting the successful transition to adulthood for older youth. So what we do with the goals that we review, as well as some of the priorities, is we try to make our examples link to those because that's going to be an important feature. The second main goal of the waiver is to increase positive outcomes for infants, children, youth, and families in their homes and communities and improve the safety and well-being of infants, children, and youth. This feature about in homes and the communities, that's also another area of emphasis in the Children's Bureau. It was covered in the well-being IM that came out a month ago, where the traditionally most money and resources have been targeted at children in foster care. And the interest is to try to also shift resources into the homes to prevent those children from coming into foster care either for the first or second time. So that's one of the key elements of that goal. The third goal is to prevent child abuse and neglect and the reentry of infants, children, youth into foster care. And so we're going to have some examples of actually real data drilling down, or in some cases simulated data, that might respond to a hypothetical waiver that shows one or more of these goals. Now the new IM introduces some new language and some new areas of focus, and the one we wanted to cover was the areas of priority. There are 4 of them. The department will give priority to projects that test or implement approaches that will produce positive well-being outcomes, with a particular focus on trauma for children who've been maltreated. Again, this gets at that well-being IM that came out a month ago. There's a lot of discussion and focus about a better understanding the trauma that children have experienced, tailoring treatment and interventions around that trauma, and then measuring the improvement of that child, not just on the global safety and permanency outcomes that we're mostly familiar with, but on the actual social, behavioral, and emotional functioning of that child. And that well-being IM a month ago gives some examples of that, but that's the feature of that first priority. The second one, enhanced social, emotional, that should say well-being of children and youth available for adoption or have been adopted, especially for children who've been in care for long periods of time. So the second priority is focusing on this adoption group. The third priority of the new IM is to yield more than modest improvements and contribute to the evidence base. So the evidence base is a key important element of the new IM, as well as the new focus area of the Children's Bureau. And this is to consider the use of evidence-based interventions in not only in the waiver demonstrations, but in many interventions throughout child welfare. And you'll get some assistance with the TA with that, and we'll talk about some of those resources you have. If you're not familiar with the evidence-based work, we do have TA that can help you identify interventions that might meet that criteria. And the fourth priority of the IM is to leverage the involvement of other resources and partners, including proposals to establish financial incentives based on achievement of positive outcomes. And some of the examples will be talking about costs and how the waivers might affect cost savings in your setting. And that gets at a feature of the waiver about cost neutrality, which we'll be covering throughout. Okay, strategies for selecting a focus. So the first strategy we just went over was the focus on the 4 priorities of the IM, and you may develop a waiver proposal or an intervention based around one or all of those priorities. The second strategy, which you might do along with the IM priorities, is to analyze your available data, and almost everyone will be doing this. and this is analyzing the available data for AFCARs and NCANs, your own data, which contains much more detail than we have here. The Child Welfare Outcomes data site, Valeria is going to be going over that in some detail, and then the data related to the CFSR findings. Almost all of our examples use data from one or more of these sources to illustrate how you might examine your own data. I'm going to hand it over to Valeria now, and she's going to be talking about these initial strategies for analyzing some existing data.
Okay, thank you, Kurt. I'm just going to pick up here and talk about the strategies for selecting a focus using available data. The first example, it doesn't require any data analysis, just simply to use some of the resources available to you on the Child Welfare Outcomes data site. And this is a place where you can go to see your state's performance as well as all other states' performance on outcome measures and some demographic and contextual data. One of the reasons you might want to compare your own data to other states' data on many measures might be just to get a general sense of, to put your own state's performance in context with the rest of the state, so you know whether your performance is relatively high, relatively low, and have a good sense of that. I mean, still remember that differences in state policies can sometimes make states less comparable to one another on some outcomes more than others. But regardless, it's a good place to start in terms of seeing all states' performance. So you can see, we're going to show state-by-state comparisons on things like entry rate. You can also see adoptions for older youth, safety and permanency outcome measures, and you have the ability to focus on either the most recent year's performance or looking at trends across years. The Child Welfare Outcome data site actually shows 4 years at a time, so it allows you a little bit of trend analysis there. So this is just a screenshot from the homepage of the Child Welfare Outcomes data site, and there's a link to it. And you can see this is a map of the United States, and you can see all states' performance on the entry rate to foster care. And when I say entry rate, we're talking about the rate of children calculated by, it's the number of children who entered foster care in a year divided by the number of children who are in the general population in that state and multiplied by 1,000. So these rates, when you see something like 7.5 being the highest for all states, that means per 1,000 children in the general population. And one reason we suggest looking at entry rates, and especially how they might compare for just looking across time within your own state, it just would be expected that if you were to focus efforts on reducing your entry rates, given that you have a waiver in place, it may result in some cost savings that can be used to reinvest in your child welfare system in other areas. So the Child Welfare Outcomes data site offers options to look at data on a map or in a table. And if you're in a table, you're able to look across years and add in more features. And let's go to the next screen. We can see there's actually this custom report builder tool where you can select as many states as you'd like. There's this multi-state quick select button. You highlight all the states, and then you choose which data point you're interested in looking at from the second box. And all of those are categories that can be expanded out with more measures underneath them. Just a word about the functionality of the site right now is somewhat limited. There's still some formatting issues if you look at some of the measures for all states. It ends up being a little bit difficult. You can't export it to Excel quite yet, but that functionality is going to be enhanced very soon, so you can look for changes in the near future in terms of being able to export your data to Excel. In the meantime, we hope that you'll be able to find all the answers you need. The information is there. So another place to look for when you're selecting a focus and looking at available data would be to look at the Child and Family Services reviews. Look at the findings from round 2 of the CFSR. The final reports are available online, as well as the program improvement plans for states. And specifically, focusing, because of the focus on well-being outcomes, it might be a good idea to start by looking at performance and ongoing PID measurement for well-being outcome measures. The broad well-being outcome measure 1 looks at if families have the enhanced capacity to provide to their children's needs. Well-being outcome 2 is the children receive the appropriate services they need to meet their educational needs, as well as children receiving adequate services to meet physical and mental health needs. So items 17 through 23 on the CFSR on-site instrument provide more detail on these elements. We encourage you to take a closer look at these items and dig a little deeper into understanding how states are doing in terms of their assessments and meeting the needs of their children through various services, etc. But please just remember that these items don't fully capture all of the domains of well-being. States just consider this as a starting point and think about ways they may enhance this and build upon it and measure their well-being further as outlined in the IM. Another thing just to consider is to make sure that the goals of your waiver demonstration projects are in alignment with your CFSR PIP goals and strategies so that they either support or build upon and move in the same direction. Certainly wouldn't conflict with them. Another available tool are the CFSR data profiles and the county composite spreadsheets that are sent out on a recurring basis, and they contain 3 years worth of data on each profile. And you can look at performance overall on composite measures and safety measures. And in addition, you can see the performance on the individual measures that are subsumed underneath the composite if you want a chance to kind of dig a little bit deeper. And so in some cases, it's good just to look at the most recent state performance. In other cases, it really makes sense to look at the trends over time. So I'm just going to provide a couple of examples where we start with CFSR measure. This is one of the individual measures under the Composite 3, and this is the first measure under Composite 3. And I'm going to show this and show how it can be stratified further in terms of looking a little bit more closely at your state's data. So this measure says of all the children who were in foster care for 24 months or longer as of the start of the year, on the first day of the year, what % of them were discharged to a permanent home by the end of the year and before turning 18. So in this example, I'm going to start off by looking at the county level, which is something that you would already receive on your county composite spreadsheet, and then dig a little deeper and look at age, and then further by age and the types of exits that children are going to. So this is a graphical representation of what you already received in the composite spreadsheet. So you can see that these are lined up in order of lowest to highest performance in terms of the % of children who achieve permanency of that group. And this is broken out by county. So you can see from this that there's a great deal of variation in the counties. And while some counties are getting very few children to permanency who are in this group, some counties are reaching about half. Another way to look at this that might be more helpful would be breaking it down by age. So instead of breaking it out by county, you can look at age groups. So we had age groups 1 to 5, 6 to 12, and 13 to 17. We excluded infants from this group because the criteria for the measure were that these were children who were already in foster care for 24 months or longer. So that age group's not represented here. But you really have a clear message from this slide that the younger the child, the greater their chances of exiting to permanency. The 1 to 5-year-olds, majority of them are exiting to permanency. However, with teenagers, only about 12% reach permanency. If you look a little further at this, you want to see, okay, so of that group who were in care on the first day and who also exited by the end of the year, what are all of what's the full distribution by exit reason? And that's an interesting way of looking at it. Rather than looking at the percentage achieved permanency, let's look at those who also exited. And you can see the breakdown by age. So of those exits for the young children between 1 and 5, see a much higher majority, almost 71% of them, were adopted. And then in the teenage group, 13 to 17, you had almost 67% of them who emancipated. So that's a really strong message that the area of focus in this case may be on those older youth. So you can see some preliminary conclusions from these data and some suggestions to look at the data further. This state may want to focus in on the outcomes for their older youth who have been in foster care for long periods of time, and think about strategies that may address increasing permanency for this group, as well as assessing well-being outcomes for youth as they transition to adulthood. So recognizing that there are so many of them emancipating from the system, how are they being, how is the state following up with them and working with them to ensure a smooth transition? Additional analyses could supplement these findings to be as comprehensive as possible. For example, you could look at the placement types for youth and the analysis costs related to various placement types. And I'm going to stop here and let John Hargrove cover an example that kind of gets at those.
Thank you, Valeria. Should put on my glasses. What I'm going to do is, as you see up there on the screen, we have an analysis of placement setting types and cost. And the plan is, and I attempted to keep this relatively more of an overview rather than get into a lot of great detail, just so we can just provide you with a sense of how to structure an approach to comparing two different phenomena, for instance, in your system to see if there's a big discrepancy and what you can do to target any kind of initiative toward it. So in doing this, we're going to look at the exit patterns of children and youth in congregate care versus family care over the course of a year. And we'll look at the exit patterns of the children and youth by age over the course of a year, and then combine those two. And one thing I would point out, and it's very clear that you're going to need to, and this, as I indicated at the outset, we're keeping this relatively simple in terms of the number of variables we look at, but you'll have access to a lot more information and can make this even a richer comparison. So the second thing is, in looking at those patterns, we're going to look at cost. And congregate care is nearly always more expensive, and there's the issue of age differentials with cost. Generally, older children can cost more, and obviously, longer time in care results in more cost. So, what was done here is we created these two curves that actually represent the exit patterns for kids in these placement settings. And just to give you a little background here, what I did is, and this was all done with AFCARS data. So I took an annual file of AFCARS data and identified a group of kids in care on the first day of the period, which in this case was fiscal year 2010. And I ID'd the ones who have a family setting, who are in a family setting or congregate care, and that would be institution or group home, with the family setting being a pre-adoptive home, family foster home, relative and or non-relative. And if you look at, on the x-axis here, you have time in care, and at the 0 point, if you look up the cumulative percent, it's 1, which is actually indicative of 100% of the kids obviously are in care as of the first day of fiscal year 2010. And then we just followed those children through the end of the year to see what the exit pattern was in terms of who was leaving care. And you'll notice that the kids who were in a congregate care setting, which is the top green line, I'm assuming you'll be able to delineate those colors on the screen, is significantly higher than the kids who were in the family setting. The actual cohort itself was approximately 11,000 kids who were in care on that first day. And the numbers are rounded, but generally speaking, about 17% of the cohort was in congregate care. By the end of the year, and those lines just cut off right there because that's the end of the year, that's where we stopped following them. And if you'll notice, like on that green line, by the end of the year of the kids in a family setting, about 38% left care. That means 62% of that original cohort were still in care. whereas the congregate care kids, only 19% left care, and that meant that about 81% were still in care. So the idea is, and for those of you who were able to watch Fred Wolshin's presentation a couple weeks ago, the idea would be to try to bring that line down more in line with the lower line, or the family setting, which results in cost savings potentially. And clearly this is a very simple example using state data, but clearly there's other kinds of exploratory analysis that you could do. You could do this actually at the county level. You could do this at the district level, or a geographic area that you makes sense for you in terms of your own state. And then obviously it's important to consider a lot of additional intervening variables. So the point of this is we see this discrepancy in exit patterns, family settings versus congregate care. Congregate care doesn't exit at the same rate, clearly. Now, this is just to provide sort of an overall picture. I looked at this for 2009 and 2008, and the exact same pattern existed. So on the next slide, what I did was broke this out by age intervals. Now, clearly, it goes from 1 to 5, 6 to 12, 13 to 17, because, well, frankly, there's generally not a congregate care is more utilized by older children than younger. So, but clearly, there's an additional pattern that exists, which is the 1 to 5-year-olds tend to exit at a higher rate than the older kids. I know many states over the last few years, and particularly within the context of some of the earlier waivers, I think a number of states looked at this issue of congregate care versus family settings. And so this is, for those folks, this is probably not new and different, but I think the idea is looking at the structure that exists and how to potentially approach this. Because frankly, you could do this looking at taking a cohort of kids who got adopted in one year and following them in the next year to see what percent of those kids, result in a post-adoptive placement. And while those numbers would be relatively small, if you did those at a smaller geographic level, you may have certain areas in the state in which it's more of an issue than others, and you could investigate that even further and potentially develop initiative related to that. So, if we go to the next slide, and this slide here is where I just combined all of them and focused on the kids in congregate care. And the thing that is very telling about this, because it sort of flies in the face of what the logic was earlier, but if you look at it more closely, it says a lot. It says some very important things. The point is the top lines are actually the younger kids, and it turns out that the older kids in this particular curve, this particular chart, exited a higher rate. So this seems to fly in the face of everything I had said, but what turns out to be the issue here, and this is a point of investigation for a state if you ended up with a pattern like this. First of all, the first two lines do not have a significant number of children represented there. However, the cohort, when it was constructed, identified all the kids in their age as of the first day of the period. So they were followed to the end of the year. Well, a very large percentage, nearly 2/3 of those kids were 17 years old as of the first day of that period of the year. Consequently, over the course of the year, they began to emancipate. So that's why this line goes against the grain of what was initially done, because that was done all globally without considering the particular setting type at the time those lines were constructed. So what it potentially means is that if you've got kids on the first day of the year who are within a year or so of turning 17, you could potentially begin to focus on those kids as a group and see if there's any kind of initiatives that you could put in place in terms of trying to assist those kids in achieving permanency. So the bottom line is nearly 2/3 of those kids were 17, and it was nearly 80% ended up emancipating over the course of the year. And this is sort of part and parcel, and it's not a surprise relative to the slide that Ms. Fajardo had earlier about where the kids went who were older in terms of their discharge reasons. And the other pieces to this to consider, and I can't emphasize this enough, there's a lot more variables to consider here, and I think one that's not in these slides that's very important is the amount of time the children had spent in care as of the first day of the year. So you have this existing amount of time in care that's a pretty influential variable in terms of the kids' experiences as the year progresses. And there's many others. And obviously within the context of the AFCARS data, we don't have all that information. But the point is you can do some exploratory analysis with what is fairly limited data in terms of covering the depth and the breadth of everything that's useful in this process. So in the next slide, in doing any of these things, there's a number of things you really, really want to consider is how many children does this represent? As I indicated on that last slide, those younger children, there was not a large number of those children. And in general, if you're going to examine congregate care, it tends to be the older kids who utilize more of the congregate care. So that, down to the next point is how old are they? And where do they discharge to? I mean, it may look really great that you have the kids are exiting at a really high rate, but if they're all discharging to emancipation, it's an issue in terms of permanency. And then there's always issues around data limitations and if there's probable data quality issues, because the finer grain you get on some of your analysis, the smaller the ends are going to get, and they become a bit more volatile as well. So in the other general question is, and Kurt touched on this as well, is what other information do you have that can help inform or provide some context to this information? So with that in mind, the congregate care versus family foster home, if we move to the next slide, this is just some things to think about in terms of the cost involved. That the congregate care in this particular example, and these numbers are rounded and just provide a pretty vivid example of what the cost means. The congregate care is 2.5 times more expensive than family foster homes. But when you look at this breakdown, it's pretty telling what happens. So congregate care makes up approximately 18% of the population, but the daily rate is 97 a day versus 39. So even though they make up less than 1 in 5 of the population, they're consuming nearly 40% of the total dollars spent. So the obvious goal would be is if you could move the kids to permanency and have them leave care and you have a complete savings of the 97, or if they moved from a less to a more or less restrictive environment, you're going to get the cost residual savings between the 39 and 97. And then obviously all these cost savings can be reinvested into your child welfare system for, sustaining additional initiatives and making the change within the context of the waiver. And with that, I would be turning this back over to Mr. Heisler.
Okay, so this third example talks about reentry into foster care, and recall from the IM, reentry is one of the goals in the IM that waivers can consider in trying to improve. And it's also a great measure to balance out any permanency outcomes you might be tracking. For example, a state might be doing very well with permanency. They're getting a lot of kids out in a short amount of time. But if those kids bounce back in other words, they have a high reentry rate, that permanency outcome in that light may not be good. So the permanency and reentry outcome measures are often used in tandem to make sure that one is not having an adverse consequence on the other. We focus here on an entry cohort, and this differs from the reentry measure that you might be familiar with in the CFSR2. And the entry cohort is focusing on children that entered care for the first time in a 12-month period. And they stayed in care at least a year, then they discharged within a year to either reunification, guardianship, or live with relatives. So of that group, what percent re-entered care within a year of discharge? You'll notice we left out adoption as a setting that they might have gone to. The only reason we do that when we work with the data at the national level is because some states cannot track the children re-entering care who are in an adoption placement. It's often due to confidentiality rules or other limitations in their system, in their information system. So that's often why we exclude it. But in your state, if your state can track children who've been adopted coming back into care, then there's no reason to exclude that group from this measure. So this first example, we're going to be looking at trends over time. Reentry rates in this example appear to be worsening. So again, this is a state that is wondering, should we focus on reentry? Is this a problem? Is this a problem just last year, or has it been a pattern? And if they look at their data from 07 to 10, they see it's getting worse and worse. They might also compare to see how this compares with other states. But just even without that, they can see it's a problem that's getting worse. This may be a good candidate to intervene with a waiver. So then we might take another look in the next slide and examine this by age. So if we focus on just the most recent year, 2010, we can go to the next slide. So now we want to better understand, is it every kid is, re-entering just regardless of age? Well, no, we see that the reentry rate is much higher for the older children, 13 to 17. And these are rates in the context of the population. So this is a very important sign that if you were to develop an intervention, you might want to tailor it specifically to older children. And that may inform the strategy you select, because some interventions are better for younger children versus older children. Again, that's the whole reason that we try to analyze the data in this more discrete way, is to inform your intervention and make sure it's targeted. So the basic conclusions, again, we didn't go very deep. We just gave a couple examples, trend and then by age. And the state in this example sees it's a measure that's getting worse. Further, it seems to be limited or worse with the older children, but they can go much farther. They can also look at the reentry rates for kids that were reunified versus live with relatives. Is there a difference there? If so, the waiver might want to focus on the strategy that involves the placement setting they're sending kids to, because maybe there's something unique to that they can improve or address. You might also be looking at the reentry rates by county, urban versus rural. Again, there are so many different ways to examine the data. We only go over just a couple brief examples. The part of the TA that we have available for states that we'll point you to at the end is there to help you take this many steps further. Okay. This is the last example, repeat maltreatment. Again, another goal of the waiver is to increase the safety of children. And so this is one outcome that might get at that. An example, we look at repeat maltreatment by county. We break it down by age. And then we break it down by age and type of maltreatment to see if we see any patterns. So in this county, or in this state, we're just looking at 11 counties here. The bar on the far right is the overall average for the state. And we quickly see that County 10 has a lot more prior victims getting re-abused. So these are the percent of victims that had one or more previous substantiations. And so the question is, what's going on in County 10? Are children more at risk there of being re-abused? So in this example, we're going to hone in on County 10. Again, your waiver, depending on what you put together, it may not want to focus on the whole state. It may want to focus on a region or one or two counties. So this is a perfectly valid way to consider developing your intervention and really targeting your resources effectively. So if we take it a step further, and now we're going to look just at County 10. We're ignoring the other counties right now. And we're going to break out those re-abused children by age to see if there's a pattern there. When something becomes very striking, the school-age children are being more likely to be re-abused. Is this because they're in school and they have much more contact with teachers and other mandated reporters? If so, if that's a feature that is occurring throughout your environment and your setting, that again may inform your interventions and services, because if that school exposure to school is influencing that measure, the experience with the school system might be a place to leverage some resources and explore some initiatives. And then lastly, we now focus only on those age 4 to 7 children. Even though the kids older than that were also more at risk, but this was the highest risk group. So of this group, what kind of maltreatment are they coming in for? And we can see most of these children age 4 to 7 who had a prior victimization already are coming in this time with neglect or other maltreatment. Now, neglect is the most common form of maltreatment that we see, but the fact that there's so many in this other maltreatment category is interesting. And each state has a different reason why they would assign a child's disposition to that category, and that's a category that shows up in the NCAN's child maltreatment reports. But generally, the other maltreatment category usually includes things like threatened harm, domestic violence, lack of supervision, exploitation. It really differs by every state. But the point here is that this state may have most of its resources focusing on physical abuse, sexual abuse, neglect, the very common things. But here's a very large percent of children that are experiencing some other form of maltreatment that the state may not be aware of or may not have a lot of resources around. This may be a good place to develop a waiver around to focus on this group. Okay, so this is our last slide. We covered a lot in a very short amount of time, and we covered it very broadly too. What we did not focus on is the intervention and evaluation component of the waiver. There will probably be webinars in the future or other pieces of TA that address those. But we do have an evaluation contract in place to provide TA to states once they submit their letter of intent. And that TA can become very important for states. So if you are a state that does not have a lot of resources in regards to analyzing your data or designing and evaluating intervention, the TA that we have available can be very useful, and they will work with you very closely to help you develop your proposal and your evaluation. But the process does begin with a letter of intent, and that's June 4th, and that's just a brief description of the proposed project. And then the final proposal is due July 9th, but proposals after that date will still be considered. But the goal, we encourage every state to at least submit a letter of intent to get that process started, because that can get you connected to the TA that we have available. If you have questions specific to the waiver and the policy-related questions, you can email that link right there, cwwaivers@acf.hhs.gov. Also, for more information, we mentioned this link on the first slide. You can look at some current and past waiver projects. There's been evaluations done on all of them. And you also have 2 phone numbers that you can contact here in the Children's Bureau for people to help you understand any details of the waivers. So we're going to take some questions. We have some questions that have come in through the online system. We're also going to take some on the phone. But we are not in the position to answer any detailed policy questions or things specific in that area on this waiver. If it's something pretty straightforward, we'll try to answer it. Those are best asked of Liliana Hernandez or Gail Collins, or sending to that email. So we'll try to focus on the questions that get at analyzing the data, drilling down, the general strategies, basically the focus of our webinar today. So let's start with maybe the phone. I think Mary, our operator, can open up the phone lines.
Thank you. Thank you. We will now begin the question and answer session. If you would like to ask a question, please press *1. Please unmute your phone and record your name clearly when prompted. Your name is required to introduce your question. To withdraw your request, you may press *2. And it will be one moment for our first question. I'm not showing any questions at this time, sir.
Okay, so we have no questions on the phone line right now. We have some questions that have come in, and we're going to sort of try to read these on the fly and see if they're a good question for us to address now. Again, any question that we don't get to right now or can't go into enough detail with, we will try to follow up and make the answers available to everyone later after this webinar. We have a simple question: who would be the best person to talk to regarding questions about fiscal matters? Again, that's probably a question best addressed to either that email, the CW waivers at ACF, or contacting Liliana Hernandez and Gail Collins. So we're not sure exactly what, in regards to fiscal matters, the questioner is getting at, but I would definitely start with those two contacts on this slide. Let's look at another question. It seems like a number of interventions could save money in one area, but result in increased expenditures elsewhere. For example, to move kids from congregate care to foster family homes, one would expect to spend money on services and or training to prepare foster parents for the special needs of kids in congregate care that those kids often have, or at least recruiting the additional needed homes. Any thoughts on useful data sources for assessing the full impact of an intervention or how to account for the full range of impacts? The TA network that you would be connected with will definitely have a lot of input and be able to direct you to a lot of resources. But as far as that last question, thoughts on useful data sources for assessing the full impact of an intervention, it really gets at the evaluation design, which is going to address whatever the outcomes you want that your initiative hopes to address. And that is really going to vary tremendously on the strategy you choose and the goal that you're trying to improve. So it's a difficult question to answer as far as the data sources. There are many, particularly in the area of evidence-based interventions, if that's something the state's considering. There are a lot of resources that we would be putting you in touch with. We've gone over the data that we have here at the federal level, AFCARS and then CANS primarily. Your state systems have much more data than we have. An example might be data on the well-being of children. So several states will assess the child's social, behavioral, emotional functioning. It's a very important feature of the well-being IM that came out last month, and it's a feature we didn't cover a lot in this webinar, but in addition to sending a kid home to permanency, it would be important to follow up to see, is that kid thriving? Is he doing well in school? Is he happy? Is he functioning well in his relationships? Just the fact that he went to permanency will not tell you that. So the data sources that might get at that piece of assessing the impact would be any assessments that are being done in the child figure system. If you don't do them now, that may be a part of your waiver, that you would use those assessments to follow the kids over time to see how well their functioning is improving.
And I don't know if this is a piece of that question as well, but and there's certainly people in your state that will be able to speak to this a lot fuller and richer, but you could actually, if you could actually simulate a situation related to that could, if you're thinking about it in the context of cost and savings, because you're going to have a lot of fixed costs associated with the pool of service providers and how much it's spent on a recurring basis and how much it costs to move kids from one setting to another, et cetera. And you could actually simulate, if you were to take 100 kids and move them from congregate care to a less restrictive setting, I'm sure that some of the cost accounting in your state has dollars associated with those approaches, and you could simulate that and use it in tandem with what Kurt has referenced in terms of, an on-site evaluation and so forth. So, but you'd need to really, I think, marry the two together if you wanted to get that full cost savings picture, in addition to how effective it is in terms of outcomes for the kids.
Yeah, I realize I did not connect my answer to the issue of cost, so thank you for clarifying that. Question, review the application dates and explain what the letter of intent is due. These are all listed in the waiver IM, which came out on May 14th. That waiver, we have a link to it on the website. It's available on the ACF website. The letter of intent, which is simply a brief description of the proposed project, is due June 4th. And that will put you in touch with the TA that can work with you to develop your proposal. And the proposal is due July 9th. But proposals will still be considered after that date. There is funding to fund at least 10 waivers per year. So if we get 15 proposals, we can only fund 10 of them. And but we don't want to not accept proposals that come in later. So we will continue to accept them. But the goal is letter of intent June 4th and the proposal June 9th if possible. And the letter of intent can be one page. It can be a very brief proposal, a brief description. It just helps us prepare and anticipate the kind of resources and TA we might need. We need to build in preparation for proposals that would be coming in.
And with respect to that letter of intent, it was explained to me, as Kurt mentioned, it can be relatively simple, an overall view, but it really serves as a catalyst for further communication is really the way they're seeing it, so that someone can ultimately get in touch with the individual who passed along the letter of intent.
One last question is...
the details around that are found in page 20 of the IM, as I've been so dutifully informed.
We also have a question, will we have be able to have a copy of the PowerPoint? Yes, we will make that available. We will definitely get that to everyone who has registered for this webinar. Those are all the questions that we have. Thank you very much for your time and participation. We look forward to working with you. And again, please do not hesitate to contact the resources that we put on this last slide if you have any questions about the waiver initiative, or contact any members of the data team if you have questions about strategies for drilling down into your data.
Thank you for your participation in today's call. The call has concluded. You may disconnect at this time. Thank you.